Hi everyone, my name's Danielle and welcome to or back to my channel. In today's video, we're going to be talking all about diabetes. This is the very first part to my series about diabetes and its links to skin conditions. I wanted to give you guys a bit of a background about exactly what diabetes is, just so that you can understand the rest of the series, because we are going to be talking about similar kind of anatomy and physiology. So when you listen to future videos, you can be like, oh yeah, I remember this from this video. I would like to start off by stating a disclaimer that I am a student from Victoria University studying my Bachelor of Dermal Science. I do not specialise in diabetes and I do not have a medical background. This video is all for educational purposes. This video does not take into consideration your personal journey, so if you are experiencing any skin conditions because of your diabetes, please go and see your dermatologist or your dermal clinician, as well as seeking out the help of an endocrinologist to aid with the management and control of your diabetes. Okay, now that that's out the way, let's get stuck into the video. Diabetes is extremely common, and I'm sure that you or someone that you know knows someone who has diabetes. According to Diabetes Australia, diabetes is a complex and serious condition that affects the entire body, where an individual cannot maintain a healthy level of glucose in the blood. Did you know the number of people with diabetes worldwide has more than doubled in the last 20 years? Now, there are three types of diabetes. So we have type 1, type 2, and gestational diabetes. Now, firstly, I'm going to be talking about type 1 diabetes, and type 1 diabetes can be diagnosed at any age and is slightly more common in men. Type 1 diabetes occurs when an individual has a destruction or a damage to the beta cells. The white blood cells attack the beta cells within the body because they think that they're a foreign invader that they need to get rid of. And as a result of this, your body starts to produce little to no insulin. Now, you're probably wondering, what is a beta cell, Danielle? Beta cells are what produce insulin in the body. And this insulin production occurs in the islands of Langerhans within the pancreas. Islands of Langerhans are islands of endocrine cells that are scattered through the pancreas. They are responsible for the endocrine function of the pancreas. So they are islands of mixed populations of endocrine cell types. Each island contains alpha cells, beta cells, and delta cells. So in short term, you have your pancreas, and then inside your pancreas, we have your endocrine cells. And your endocrine cells are made up of three different types of cells, which are your alpha, your beta, and your delta cells. And each one of these have different responsibilities within the body. So really, endocrine cells is an umbrella term for these three different types of cells. And the islands of Langerhans are a mixed population of these three different types of cells. Confusing, I know, but we're only focusing on the beta cells for now, so just keep that in mind. Anyway, due to all of this, someone who has type 1 diabetes cannot produce insulin. Insulin is extremely important in the body because it controls our blood glucose levels. Interestingly enough, type 1 diabetes is normally due to a genetic predisposition. However, it's also likely as a result of environmental triggers. And something that I found really fascinating is that those who are born in the US spring, which is the Australian autumn, are normally more immune to having type 1 diabetes. Without the body producing enough insulin that it needs, your body starts to burn its own fat, and as a result, a chemical substance is then released into the blood. If this is not treated, this can turn into ketoacidosis, which can cause an individual to have side effects of vomiting, flushed cheeks, and rapid breathing. If this occurs, the individual will need to be taken to hospital. For treatment of type 1 diabetes, insulin cannot be taken orally, as the enzymes in the stomach will break it down before it can get to the pancreas. So the individual will often carry around an insulin pump that is connected to their waist and works via a tube that is connected to a reservoir of insulin. This is then connected to a cannula that is inserted under the skin of the abdomen. The insulin pod can be worn on the abdomen, lower back, legs, and arms. Pumps are programmed to dispense a specific amount of rapid-acting insulin automatically. Basically, what will happen is the individual will have to program the machine every single time that they eat. They will have to tell the machine the amount of carbohydrates specifically that they're about to consume, as well as their current blood glucose level. Then the pump will basically do the rest of the work for them. The machine will release a specific amount of insulin when it realizes that there is a drop in the blood glucose levels, which balances it out. Some research suggests that insulin pumps can actually be more effective at balancing out your blood glucose levels than the injections. Injecting insulin is actually the most common form of treatment and management for type 1 diabetes, and involves injecting insulin underneath the skin. A regimen of 3 or more injections per day has been shown to level out your blood glucose levels, as well as maintaining a healthy diet and exercise. Okay, let's discuss type 2 diabetes, because it is quite the polar opposite. Type 2 diabetes is a progressive condition that affects 415 million people worldwide. The body becomes resistant to the normal effects of insulin. This can mean that the individual can lose the capability of producing enough insulin in the pancreas. There is an increase in the blood glucose levels in the body, but rather it being used for fuel in the cells, the levels of blood glucose just continue to accumulate. The insulin receptors that move glucose into the cell do not recognize that the glucose is there and that it needs to be converted. Over time, this can cause damage to the blood vessels, which can cause a whole bunch of different health complications. These health complications include loss of sight and nerve damage. Complications in the larger blood vessels can actually lead to stroke and heart disease. Skin conditions are often more prevalent in those with type 2 diabetes because they already have that overstimulation of the glucose, which actually triggers the inflammation process. Type 2 diabetes can be caused due to environmental factors and genetics. However, excessive fat and sugar consumption can increase your chances of getting this disease. Type 2 diabetes normally affects the elderly. However, there has been an aggressive phenotype that has been linked back to an early onset of type 2 diabetes that normally affects people between the ages of 15 to 30. This phenotype has been linked back to cardiovascular death. Again, a healthy lifestyle has been linked back to aid in the prevention of type 2 diabetes. Pathophysiology is due to insulin insensitivity as a result of insulin resistance, declining insulin production, and eventual beta cell failure, which is similar to type 1 diabetes. However, the involvement of an impaired alpha cell function has also been recognized. Remember, alpha cells is part of the 3 endocrine cells that are doing their thing inside the Langerhans islands. Alpha cells are responsible for reducing glucagon, which is a hormone that regulates your blood glucose concentration. And it does this by increasing glycogenolysis, which is a production of sugars, and decreases glycolysis. And glycolysis is basically when one glucose molecule is broken down into 2 molecules of previc acid, and this is where it starts to supply energy. It's still unclear exactly what causes type 2 diabetes. However, insulin resistance is normally the underlying abnormality, along with pre-existing gene phenotypes and lifestyle habits. In terms of treatment, a healthy lifestyle is generally recommended. There are also drugs that make their way through the gastrointestinal tract and include alpha-glycosidase inhibitors that actually slow down the glucose absorption. Regular blood sugar level checks are essential. At-home kits are also available where the individual will prick the side of their finger and this will tell them their blood glucose level on the spot. Okay, now let's move on to gestational diabetes. This type of diabetes only occurs during pregnancy. I'm going to speak about this one very briefly because the main 2 ones that I want to focus on during my series are type 1 and type 2. Gestational diabetes is actually one that will just go away when the baby's born. A family history of type 2 diabetes and ethnicity are 2 main risk factors. Once again, the underlying pathophysiology is an increased insulin resistance and transfer of glucose due to hormones present in the placenta, as well as beta cell defects in the pancreas. During pregnancy, your body needs to be producing 3 times more insulin to keep your baby healthy and to maintain your energy levels. Therefore, a woman with gestational diabetes cannot produce enough insulin, which causes your blood glucose levels to increase. Not only this, but the metabolic adaptation during pregnancy actually places further stress on the beta cells, and the adipose tissue formation during pregnancy causes even further stress on the body. Having gestational diabetes can actually increase your risk of having type 2 diabetes later on in the future, so maintaining a healthy exercise and lifestyle habits is often essential. Having gestational diabetes does not cause any harm to the baby, however, you do need to make sure that you are maintaining your blood glucose levels all throughout your pregnancy. I know that was a lot of information and I'm so sorry, but I hope you learned something today. Make sure that you comment down below if you have diabetes yourself, and also let me know your experience with diabetes linking back to the skin. I'd be so interested to know if you have any skin conditions that have linked back to your diabetes. Don't forget to like and subscribe to my YouTube channel to follow along my series all about diabetes and how it links to the skin, and I hope to see you guys in the next one. Bye guys!